Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for joining today's video. You're here because you have some questions about sensitivity after a crown. And it's one of the most common things that we find when people are referred to us is they've had a crown or they've had a bunch of dental work and it's still sensitive, or it feels bulky, or it's just not comfortable. Something just doesn't feel right. Maybe you've gone back to the dentist 7 times and they keep grinding on that crown and making it flatter and flatter, maybe grinding on your other teeth, and it just hurts. We had a patient come in the other day who had seen us a few years ago for some dental work, and then he moved about an hour away. So he went to an office that was closer to his home, and he had exactly this experience happen where he had a crown put on and it was sensitive and they were grinding on it. Now the teeth next to it were hurting. And so he decided to come back and see us, even though it was further, because the work we did, he had no problems with. And this is a big reason why I quit doing crowns almost 13 years ago, is because I just didn't feel good about grinding a tooth down to a little nub and putting something over it that then often became sensitive or felt worse than when we started, or now the tooth needed a root canal, and I hated putting my patients through that. So I just didn't feel good about it. And then I discovered something called biomimetic dentistry and implemented that in my practice. And there really just aren't that many of us around that do this. And it's because it takes longer to do it. It takes extra training. It takes extra time. It takes extra materials. You have to train your team on it differently. But I found that we have way fewer root canals. Studies will say 2/3 less. I found that it's probably more like 80% less, maybe 1 out of 20 teeth that we treat now may need a root canal. And that's usually because there was so much existing damage that the nerve was already infected. And so it's a bummer when that happens, but for the most part, we can predict that. So in the case of this patient that I mentioned, we were able to get several teeth treated using biomimetic dentistry, no crowns, more comfort, more long-term health, less likely to lose teeth or need implants. So if you're interested in learning more about the differences and how this may benefit you, or if you have teeth that you just hate because they don't feel right or don't look right, give us a call or shoot us an email on our website. Be happy to meet with you, see if you'd be a good candidate for this, and you can learn new ways to make your teeth look better and healthier than they ever have. So thanks for checking out this video, and look forward to seeing you on the next one. Have a great day.